And I love your whole point about imaging being the front door. I used to say I oversaw imaging in lab for many years. And without imaging in lab, everything comes to a halt, right? That's how you're diagnosing things and you're moving forward.
I just had a conversation with one of our surgeons the other day in the hallway, and I was talking about, and this could apply to nurses as well, in that OR environment where it can be very, very tense and frustrating, and the whole team feels frustration, right? When things are going well, they're going well, and then when things are like, especially with imaging or whatever is going on, and everybody senses that, frustration, and people become tense. And I was advocating for my technologist who was in a specific case, and I said, what I need from you, and I think this applies to our nurses and our techs everywhere as well, is that everybody feels like they are part of a team. We are collectively involved in a successful outcome for a case for a patient. And when everybody feels like they are acknowledged, recognized, and welcomed into that team as part of a practice of people that are working for the best outcome for a patient, then we're going to do great. And I looked at him, I said, because I'll guarantee you that in that moment, you really need that image to complete what you're doing. Because I said, otherwise, you've got a whole lot of guessing to do without that image, and you're not going to get very far.
That's right. Well, it's funny when you guys were talking about I'm picking up on things. I'm looking back. One of the nurses that I probably came across was first in my years of overseeing imaging. We were an outpatient center at a breast center, and we had a nurse navigator. Her name is Michelle Spear. If she's listening, she was outstanding. It was one of these people who just lit up a room and was the person you wanted when anyone was getting unfortunate news or was nervous or had questions, and just handheld her, right? And she was the one that they would go to talk about, okay, we have a finding and now here's what's going to happen. And they'd educate that. And I'm going to help coordinate your biopsy. I'm going to coordinate your visit with the surgeon. I'm going to be there when you meet the oncologist. It was just an amazing setup. And then they, as the program grew, they added some more resources to go with this particular person. It's funny. I hadn't thought about Michelle in a while until you guys were talking, and giving her a shameless plug. She also is she's my office mate next to me. But I love that. And that was a place where I really saw the value of having someone that could do that. And then to your point, there were some hard sticks, or we had some recovery areas where the technologists were like, listen, if I'm sitting with a patient, I can't be running the machines. And then we're like, that's not efficient. And plus some of them were like, well, what do we do in this situation? And where I was going here is we had a joint commission inspector, and I'll never forget this one. And they're coming through and they said, okay, if somebody has a allergic reaction to the contrast, it was MRI where we were, or this, that, or the other. And they asked the radiologist this, okay? The radiologist was there. Said, what do you do? And the radiologist obviously is the person that's supposed to be in charge. And the radiologist is like, well, I call the nurse. It was amazing. And we were all laughing. Even the Joint Commission person started laughing. And I think he actually said, I haven't intubated anything since a cat in medical school. I always call the nurse. That was his phrase. And we couldn't believe it came out. And secondarily, we laughed. But we all joked afterwards that, hey, to the nurses, we're like, you indirectly got the most amazing praise there was, that, the radiologist who's ultimately responsible for what goes on the site just said, you're the one in charge if there's a situation.
I actually love that you brought up contrast reactions, because I think that's a point where the relationship between nurses and techs really shines because of exactly what you said, especially in our off-campus locations. So take ambulatory imaging, for instance, where we may not always have a radiologist on site and we lean into other providers to cover contrast reactions. I can recount several times as a leader in radiology where a provider covering contrast was like, they're fine. And the nurse and I looked at each other and we're like, no, come back, and because contrast reactions can crump so quickly, or they look great for a minute and it's a little delayed and then they're not okay. And when the nurse and the techs give each other that look, and we're like, elbow them back. And so that's when like the expertise of both, because of historic knowledge, and nothing replaces historic knowledge. When you know what you've seen before and you reflect on what you're seeing now, and you just that gut feeling. And no matter how educated we are, there are just times as nurses and techs when your gut feeling tells you something else has to happen. And that relationship starts to work seamlessly in those moments. And there have been a lot of patients' outcomes that were much better because of it.